Hello, everyone. This is Jie Li from Respiratory Care Journal. Today, we invite my two colleagues at Rush University, Dr. Scott and Dr. Kaur, to introduce their randomized control trial on evaluation of closed suctioning system with integrated tube scraping technology for us. Thank you for coming. So, Dr. Kaur, do you want to briefly summarize the main objectives and the findings from your study for us?
Sure. Thanks for having us on this, Dr. Li. And we're really excited to talk about our study. So in this study, again, as you mentioned, this was a randomized control trial conducted among adult patients who were admitted in the intensive care unit. So our primary objective was to see if using an suctioning device that can also clean the inside of the endotracheal tube, does it have any impact on patient outcomes? And when we say patient outcomes, few important ones that we were interested in was duration of mechanical ventilation and the time to first successful spontaneous breathing trial. So those were our two main study outcomes. Yeah, so that's
we also, just to add to that, I mean, you can see, you're like right in the abstract of the paper, we actually measured things like duration of hospital stay, thinking that if it impacted time on ventilator, it might have those impact. And we actually measured some occurrence of ventilator-associated events.
It is not easy to do a randomized control trial. So I really want to know what motivated you to conduct the research on using this technology in contrast to our standard in-line suctioning.
So you're right. It's certainly not easy to conduct a randomized control trial. And I just want to take this moment to thank the whole team. This was certainly a team approach. We certainly couldn't have done this without a whole lot of people helping us. So it was really a team approach, and we're very lucky to have a great group of RTs and other folks and physicians to help us out. So why do we do the study? Well, you know, these products that were similar, that have had the capability of removing secretions and biofilm from the inside of endotracheal tube have been on the market for a while. And there's actually been several other studies that have been conducted looking at their abilities to remove biofilm and remove secretions. And actually our team even published a paper previously demonstrating that for several patients, it actually does reduce airway resistance caused by those secretions. What remained, the question was how does this, doing this, clearing the endotracheal tube out of secretions, how does it impact those important outcomes? Some of the studies that have been prior to this one were, you know, observational, or perhaps they were just smaller studies. And so we designed this one to that's much larger. We actually had 272 total people out of 136 people in each the standard suction group, and then the device, the interventional group, if you will, the device. And so we conducted a larger study to help us better understand the impact of those devices on those outcomes.
So clearly it's important to have a randomized control trial on important outcomes versus just the study pre versus post to show we reduce resistance. Sometimes the physiological outcome may not lead to the terminal outcome difference.
Exactly.
So that's clearly why we need a randomized control trial.
Yeah, exactly, because we noticed that it can reduce resistance, and then the natural question is, what does that mean? Does that impact anything that matters to us clinically? Like, again, the outcomes that we went after, like how long you're on a mechanical ventilator. So yeah, again, I for new researchers out there and those who've done it, you know, randomized control trials are certainly complicated and difficult to pull off, but it's the level of research we need to, I think, get better answers to questions.
To generate higher level of evidence.
Yeah.
So Ramandeep, why not you tell me the key takeaways from the study finding for our respiratory therapy bedside?
Sure. So the key finding for our study was that routine use of this experimental device, which has the capability of cleaning the endotracheal tube, does not lead to shorter duration of mechanical ventilation. It does not lead people succeed in terms of spontaneous breathing trial earlier as compared to those who gets a suctioning with just a standard device. So those were our two main outcomes of the study, that it did not reduce the stay on the ventilators. And then as Dr. Scott mentioned, that we also had some secondary outcomes. We were looking at maybe can it help reduce your ICU stays and hospital stay? And unfortunately, we didn't see any difference in terms of our stays as well. And lastly, we looked at our VAE rates, which is vent-associated events, and that also we did not see any. We saw a direction, but it was, again, not statistically significant for us to conclude in terms of findings. So yeah, the most important point is the routine use. Is probably we don't need this device for every patient who goes on the ventilator.
So what do you think about the future research in this area?
Yeah, that's a great question. So we've been talking a bit about that, and I think that our team is leaning towards, and we wrote this actually in the discussion of the paper for those that are interested in reading the paper. We feel that what we should probably do is focus on identifying those patients that have clinically important amounts of airway resistance that are secondary to those secretions in the biofilm buildup. So finding ways to say, this patient has a tube that is indeed clogging up with secretions, and then using the devices to clear those to see how that impacts on their clinical outcomes. So I think what Dr. Kaur just said, probably for everybody all the time, probably, at least based on our results, it appears that using those kind of devices is probably unnecessary. But it seems likely that it would be beneficial to those that are having those secretions. We just got to be better at identifying them and then using them when that starts to become recognized.
Thank you. This is a great study. Congratulations. And also, I want to particularly thank for Dr. Scott. Today his birthday. Happy birthday, Dr. Scott.
Thank you.
Thank you.
I appreciate it. This is the fun way to spend birthday. Talk about research.
Great. Okay.
Yeah.
Thank you. Bye-bye.
All right.
Thanks, Dr. Li.